Hello friends, Namaskar. I am Dr. Rajesh Sagar, Professor of Psychiatry at AIIMS, Delhi. Today let's have a heart-to-heart conversation about a condition many people have heard of but few truly understand, ADHD or Attention Deficit Hyperactivity Disorder. ADHD is much more than being too active or not listening. ADHD affects how people pay attention, control their action, and manage energy. In India, prevalence ranges from 2% to 17%. The important functional consequences of ADHD are academic deficits, school related difficulties, peer neglect or rejection, accidental injury, poor adjustment, and substance use. Now, what does ADHD look like? In children, you may see constant fidgeting, daydreaming in class, losing things, not finishing homework, talking out of turn, or interrupting. These are few symptoms, but there may be many more symptoms. In a few, it may be continued in their adulthood, which might show up as struggling to stay organized, feeling restless or overwhelmed, acting on impulse like making sudden decisions. Interestingly, ADHD can look different in boys and girls. Boys might be more obviously hyperactive. Girls, on the other hand, may appear quiet or dreamy, and their symptoms often go unnoticed. So, how do we diagnose ADHD? There is no lab test or scan. A trained mental health professional assesses behavior over time through interviews, checklists, and inputs from parents or teachers. According to DSM-5 guidelines, symptoms should start before age of 12 years, be seen in more than one setting, and interfere with daily life. There are three types of ADHD. One, inattentive type, mostly trouble focusing and organizing. Two, hyperactive impulsive type, more restlessness and impulsivity. Third is a combined type, which is a mix of both. Now, what causes ADHD? Well, there is no single cause, but research suggests it linked to genetics, brain development, exposure to toxin during pregnancy, and sometimes low birth weight or premature birth. Now, the good news is ADHD can be effectively managed. Treatment options include medications like methylphenidate or atomoxetine only under doctor's supervision, behavior therapy, which helps with managing emotions and improving habits, support at school and home, like parent training, counseling, or coaching for adults. Lifestyle changes also helps a lot, like regular exercise, a balanced diet, proper sleep, and structured routines, which makes a big difference. Limiting screen time as well is also important, and keeping things organized, which helps reduce distractions. Teachers and parents, your role is very crucial. Use simple instruction, praise and reward system, break big tasks into smaller steps, reduce distractions. In India, ADHD care is available at AIIMS and other government hospitals, child guidance clinic, and special educators are there to help too. Support groups are growing both online and offline. Before we end, here are few quick tips. 1. Set a daily routine. 2. Praise a good behavior. 3. Reduce distraction. 4. Stay in touch with your doctor. And remember, children with ADHD are not lazy or difficult. They just think and behave differently from others. With the right support and care, they can thrive. Thank you and namaste.